All right, so I think we're going to get started here. Welcome. Hello, everyone. Thank you for joining us for the SHaW Res Life Town Hall on the Pooled Gargle Testing Initiative for the Spring 2021 semester. My name is Ben Christensen, and I'll be moderating our Q&A today. We have a group of panelists with us. We're ready to answer your questions regarding this initiative, as well as a few other topics related to COVID-19. If you didn't get a chance to submit questions ahead of time, or if you think of them during the presentation or afterwards, you can always submit those to pool.testing@uconn.edu. That email address is in the description for this video. Please feel free to email anything additional that comes up. So without further ado, let me introduce who we have with us today. From Student Health and Wellness, we have Dr. Elisa Era, our medical director. From Res Life, we have Dr. Pamela Scapani. She's Executive Director of Residential Life. We have Amy Krim, Director of Residence Education. Kim Beardsley-Carr, the Associate Director of Student Welfare. And from Microbial Analysis Resources and Services, we have Dr. Kendra Moss. So without any further ado, I'm going to turn the floor over to Dr. Elisa Era, who's going to provide a brief framing of the pooled gargle testing process, and then we'll jump into any questions you have.
New testing strategy, or no addition to our testing strategies, is that if you look at the counts of positive cases across the state, our neighboring states, across the country, they're incredibly high, and the Department of Public Health and Center for Disease and Protection really anticipate those numbers are not going to start dropping until the end of February. So we really need to start out of the gate strong with a really comprehensive testing program, so that when we see an initial case, we can sort of take care of it before it turns into a few more cases, a cluster, an outbreak. So by doing really proactive testing, we're going to be able to isolate those early cases before they really expand and extend across campus. We had a really successful start with our pre-arrival and our entry testing, so we're starting in a good place, and we really want to just continue that. So what this will allow is, with this gargle testing for every residential student who is appropriate to be tested, to have access to a weekly screening test for every week throughout the entire semester. But it's really critically important to start this process now and really be diligent through the end of February.
Thank you, Dr. Era. So we'll jump right into questions that were submitted ahead of time. And if you have any that come up while you're watching, please feel free to type them right into the chat on the video. So the first one that came in was, how often am I supposed to submit the gargle tubes?
So those submissions, again, are going to be once a week. You'll have a designated day, and with our partners at Res Life, we've been able to divide the campus into thirds, and so sort of certain regions of the campus will be tested on the same day, but it'll be Monday, Tuesday, Wednesday, every week. We expect students who are asked to submit a gargle sample.
Thank you. And where can students locate the collection buckets?
So the location of the buckets vary depending on your area. If you live in a traditional hall area with a larger shared bathroom, like North Campus, Northwest, West, they're generally going to be in the bathroom that you go to, that's assigned to you. In the suite areas like South and Gargle and Busby, they're going to be located at the elevator on each floor. And in Northwood Apartments, they're going to be located by the laundry room and the bus stop. And in Hilltop Apartments, they're going to be located by the exit door facing the parking lot area on each side of each building. You'll receive an email the business day before your day giving you this information. So if you didn't write it down, rest assured you'll get it in an email from us.
Great. A couple of people asked similar, how will they find out the results of the test? Will they come through as an email or a text message?
So anyone who is part of a positive pool will be notified through a secure message from SHaW. That will be sent out the same day that we receive those positive pool test results. And then we're going to really coordinate with each individual student to bring them in for an individual diagnostic test to confirm if, they were the reason why their pool was positive. So we really need everyone to be reading their secure messages and, coordinate with us so that we can act quickly when we detect a positive pool on campus.
Great. So somebody asked how this test works in conjunction with the other tests being on campus, and if they're called in for one of those other tests, do they still have to submit a tube that week?
Yes, please. So this is an addition to our testing strategies that we had throughout the fall semester. So if you're invited for an individual screening test, please come in and do that test. That does not change that we still want you to submit a pool test as well, because again, when you test negative, it's great in the moment, but you could test positive the following day. So we really want to make sure that we have close eyes on all of our residential students to keep them healthy and safe.
So going off what you said there about the negative versus positive test, several people did ask if they do test positive and they're moved into isolation, do they still need to submit a tube? And in addition, if they had tested positive over winter break, should they participate in this process?
So those are two really great questions. So one, if you test positive and are moved into isolation, then we don't want you to submit a pooled sample or a Gargle test. And in fact, you will not be submitting screening tests for the rest of the semester, whether it's an individual test or part of this Gargle initiative. And that goes back to anyone who is tested positive, and that is a PCR positive test. We want you to not do surveillance testing or asymptomatic testing for 90 days from the date of that positive test. So if we have your positive test record, we should have sent you a secure message that gives you the window of your exemption from testing. So definitely, if you tested negative over or tested positive over winter break, and you haven't uploaded or shared those test results with us, please do so, and then we'll remove you from the Gargle testing initiative. So we really want people who have, again, a record of a positive PCR test in the past 90 days not to do surveillance or screening testing or be part of the Gargle test.
Thank you, Dr. Ayer. Somebody else asked if their floor residence hall is put into quarantine, do they still need to submit a tube?
Absolutely. So it is recommended that anyone who is in quarantine have additional testing during their 14-day quarantine period. So those individuals should be invited for, again, an individual diagnostic test. You'll get an invitation because we recognize that you're in a quarantine period. But in addition, go ahead and submit that too, because that's just another chance for us to, capture if you've converted to a positive based on your exposure. So for that, I would not forego the additional opportunity to test.
Thank you. And I think this is the last question on the on who should submit, but one person asked if they have the vaccine, do they still submit a tube?
Definitely. So the vaccine is great. It's not 100% effective. And what we don't know is that the vaccines have been shown to be pretty effective in protecting the individual who's vaccinated, but we're not sure if they could still potentially shed virus that is infectious. So you could still be contagious to other people. So getting a sense of that will be very, very important. And again, no vaccine is 100% effective. So we still want everyone who's vaccinated to participate in all of our screening testing, individual testing, and our Gargle testing.
Great, thank you. So several people asked when they scan the QR code to submit their tube, they would like to know where the data goes when they scan that tube.
So when you scan that tube, the barcode and your net ID will go into a secure custom database that Squared Labs here at UConn has built. I, in the lab, will never see that information. Only SHaW will ever know which barcode goes with which person. So as the lab, I only ever know barcodes.
Very good, thank you. And a follow-up question was who collects the tubes and when? And we had touched on the days of the week, but people are asking who will actually be doing the collecting.
So a group of, I believe, student workers will be going to pick up those sample buckets Monday, Tuesday, and Wednesday afternoons. So please get it there by noon.
Okay, by noon. So in regards to the kits that were handed out to residential life students, a couple people asked where can they get an additional tube if I lost one or I accidentally threw it out?
Yeah, sure. If for any residents, if you reach out to your RA or to your hall director, they'll have spares that they can give to you. We'll have additional masks and bags located in the hall director offices next week.
Great, fantastic, because that was an additional question on the face mask. People seem to like the ones that were in the bags. So can anyone make an appointment to get COVID tested whenever and however they would like to be tested while on campus?
So yes, so in addition to the Gargle testing that you'll have access to weekly, and being invited to testing based on being in quarantine or just our surveillance of the campus in general, or areas that we want to do a little bit more active testing based on cases that we've seen, every residential student has access to 5 individual self-selected testing appointments. They're right on the portal. You'll be able to log in, use those 5 tests throughout the semester whenever you would like, and those can be scheduled entirely at your discretion.
Great. So a lot of options for people. Somebody emailed and asked if we could explain a little bit more about the colors that are shown on the university dashboard. And does anyone know what the breaking point of us being sent home is?
So the colors on the dashboard are really meant to reflect kind of how the campus is doing in general. It's a very, very holistic. So I don't know if anyone noticed when we came into campus, the color is red and you're like, wait, we have a 0.5% positivity rate on arrival testing. Why is it red? And it's because we're in a residential quarantine, an arrival quarantine, and because the entire campus is under quarantine, the color red sort of reflects what is allowed on campus and the types of activities and interactions and in-person interactions that are currently acceptable. So the color codes are going to, as we move forward, will be based on activity on campus, the success of our contact tracing. A lot of factors are going to be going into that number, but what the color really reflects is really the state of the campus. So when we're in red, we're not doing anything that's scheduled in person. We're really all in quarantine. We hope to never be in red again for the rest of the semester, but that's how we're starting out. And then as we get to February 1st and the end of this residential quarantine, we'll see how the numbers look and we'll be able to sort of set a color that is reflective of the activity on the campus.
Great. A couple people were asking questions about the vaccine. Someone wanted to know if I am an out-of-state student, do I qualify to receive a vaccine in Connecticut, or are we required to defer to our home state?
So no, you can be vaccinated anywhere. The trick with that is that it's a phased rollout of vaccine. So if you fall into a category, right now we're in the early stages of 1B, then you can get your vaccine no matter where you are. And there's a national database so that you can track where you've been vaccinated and what vaccine you received as your initial vaccine, so that when you go for your follow-up vaccine in either 3 to 4 weeks, depending on which vaccine you receive at the moment, those are the only 2 available, are 3 and 4 week intervals. You'll make sure that you have the same vaccine the second time that you received the first time. Again, each state is rolling out phase 1B, on their own, and so Connecticut has chosen to put phase 1B, people 75 and older, and then they're going to roll into 65 and older, and then all of the essential workers and frontline workers that are in phase 1B will sort of have access towards the end of February, early March. So they keep kind of changing how they're rolling that out, which is, a little bit frustrating and can be confusing. And then everybody would be eligible for a vaccine during phase 2. And here at SHaW, we will be designated vaccinators for phase 2. So if you are here and it's phase 2, we would certainly be able to vaccinate you.
Great, thank you.
So I just put
something into the chat function for all attendees. It's the portal for the coronavirus COVID information for the state. And it talks about the different phases and where we are now and what will be introduced in the next coming, we hope, weeks. And there's more information about essential workers. There's information about who might be congregate living, like how do you define that? And there's a myriad of pieces of information there that will be really helpful for folks to look at in terms of the vaccine and how do we roll that out.
Thank you. So I believe we're at pretty much the end of the questions that came in prior to, and I didn't see any additional ones come in through the chat. So I will, if any of the panelists have anything additional they want to add, or if we have any last minute questions that want to come in.
I'd like to say something. This is Pam Scapani, Executive Director of Res Life. There were a couple of questions that we received from RAs, and we addressing those. We will put them into our FAQs for RAs, and we'll talk about them in staff meeting this week. But we didn't want to spend time for the whole campus to hear what we're doing with RAs. There's questions about, are we considered essential staff, and when will we get the vaccine? And we certainly feel like the work that RAs do is contributes to keeping the campus open and is extremely important. But we're also trying to be as safe with RAs as we can. And Kim could talk a little bit about that, specifically about what happens when you're on duty. And then the question about whether or not we could push RAs higher up the list. And I know that this week we sent Dr. Error a list of all the RAs and our student workers who are face-to-face with students, so she can share that with the Department of Public Health, because right now those are the folks who would be doing the vaccine. Although, as Dr. Error said, if we get to phase 2 and we are a vaccine site, then we would be vaccinating students as well.
Great, thank you. Kim, is there anything you'd like to add?
So I'll just do my last 2 cents that yes, with this level of community spread, we're really trying to be aggressive in creating a sort of a bubble on our stores campus where we can sort of have in-person instruction, in-person interactions, keep our ourselves healthy and safe. And vaccination is a part of that, testing is a part of that, but nothing really outweighs the importance and the impact of those non-pharmacologic interventions or those control measures. So staying masked, keeping your physical distance, and washing your hands frequently keeps you safe no matter what the level of community spread is. And so despite everything else that we're doing to sort of keep our campus in a place where we can, interact the way that we want to, get instruction the way we want to, that does not change the need to really adhere to those control measures. And that being said, students who have tested positive in the last 90 days and don't need to be tested again, or even if you've been vaccinated, that doesn't change the fact we still need you to wear your mask, wash your hands, and stay physically distanced.
Thank you.
And to address the RA duty briefly, we worked really hard on focusing on the health and safety. So reiterating a lot what Dr. Err just said, they wear their masks, they wash their hands frequently, they are social distancing. When they're addressing behaviors, they're often addressing them out in the hallway. When they're entering bathrooms, they're not utilizing those bathrooms for personal use at all. They're stepping in, checking for any safety concerns, and stepping out. So we are continuing those practices throughout the spring semester as well.
Great, thank you. We did have an additional question came in regarding the pooled gargle sampling. Someone was asking, how early is too early? For example, if X building has a collection day on Wednesday, can students drop the tubes off at 2 a.m., 6 a.m., 7 a.m. through till noon, or how soon is too soon?
So it looks like the virus is pretty stable at room temperature in water for at least 24 hours. I would say don't do it any earlier than the night before. But, if you go to bed at 2 a.m. and you're not sure you're going to be awake at noon, drop it off at 2 a.m.
Great. Well, that wraps up the questions we had submitted before and during. If you have additional ones or you didn't hear an answer to a question that you had wanted to ask, you can email those again to pooled.testing@uconn.edu, and that email is in the description for this video. I just want to give a big thanks to everyone who watched to learn more about this initiative, and also to the panelists here who took your questions and took the time to answer them. So thank you, everybody. Take care.
Stay safe.